Hi, it's Martin Doyle again with the Biothermared Digital Moist Heat Pad. This is Stephanie. Stephanie's one of our students. So some of the patients that we see in this clinic, young people who've had, say, motorcycle accidents or car accidents, end up with having some whiplash, or in severe cases they can have spinal surgery to stabilize the spine if there was a fracture there, and heat can be very beneficial post-surgery. Also, people who've got chronic osteoarthritis, rheumatoid arthritis, or injuries from sport, they can get lots of neck pain, restriction. It's a common area for wear and tear. The joints are quite small, and so these people have to work, and what I recommend is that some of them do take this product to work, and I just want to demonstrate on Stephanie how we put it on. So we come on here, and that goes across the shoulder. And so we've tried to simulate an office here. I know it's not perfect, but what Stephanie can do while she's typing, she can set the time and the temperature. That can be to the one side, and so Stephanie can type while this product is on. And it goes, as you can see, it goes right down to the thoracic spine. She's upright, so she's not lying on the product, and so that would give her moist heat in the neck and in the shoulders, in the lower back. These was areas that the patient was getting chronic pain with. And at work, this could be on for an hour. It would be set a bit lower, say 50, 55, or if the patient was in pain, it could be on for less, for half an hour, but it would be set at a higher temperature, say 60. Because remember, with moist heat, we want the heat to be relatively hot, and this outer cover absorbs moisture from the atmosphere, and it's the moisture that penetrates the infrared heat. So the product's designed to be on the skin. So you can see with Stephanie that it's not on the skin. She has a light cotton t-shirt, but that's fine as well. But if you're in the comfort of your own home, Stephanie could easily take this top off, leave a bra on, and that would or get a lighter shirt or a low cut t-shirt, and that would expose the neck and shoulders to the skin, to the surface more, and you would get more beneficial heat. But obviously in work you can't do that. But for those with chronic neck and up and shoulders, this is a valid product, and probably with companies I recommend, for people who do get neck and back pain, that they have one or two of these products in their first aid. I think it would be very beneficial, other than weak pads, because it's moist, it's infrared, and the medical products. So I'd also like to remove this now. Thanks, Stephanie. And also show you, we also have patients that end up having spinal surgery. And again, I was telling Stephanie that a lot of them tend to be young people, because in their 20s or 30s, because the discs are a bit softer. When we get older, the discs tend to be a lot thicker, but it's more prone and malleable to protrusion when it's a bit soft. So, and some of these disc conditions where the disc protrudes and doesn't return, it can end up impinging on the nerve, and the patient can end up with a radiculopathy, which is some neurological weakness in the lower legs or arms, and in severe cases they may require surgery to prevent that nerve from permanent damage by the surgeon doing a decompression. And so in the back, the main patients I've seen have been young, and some of them again are at work, and so what they do, they take a different product, and if Steph just leans forward, it sits quite nicely here. And if I just give that to Steph, there's a bit of Velcro that it sits on there. And remember, if Steph pulled the top up, that could, just to expose her lower back, that product could be directly on her back at work, and that wouldn't be an issue. That way she's getting the infrared or moist heat. But you can use a low cotton top, and then what the patient can do, can set the time, set the temperature, and be able to work while they're getting pain management with the moist infrared heat. Remember, the product goes for about an hour, and so they were just using it to warm the lumbar spine up. You use it at a lower temperature, but if the patient was in pain, and remember, sitting is now classified as a chronic disease, so for those of us with lower back disc compression problems, the sitting with gravity prolongs that problem. And certainly there's a bit of an epidemic with sitting, and that's mainly to the compression forces, and that's why there's a big rush to move from sitting to standing desks. But unfortunately, it's really not having a standing desk that's the issue. It's the movement between a sitting area to a standing area, because prolonged standing can do you just as much harm as prolonged sitting. So I think the smart companies will put the standing desks in a different area. So the walking from A to B is the part of the therapeutic process that's going to help in the preventing the lower back pain. Just standing and sitting from the same areas really doesn't cut the mustard. So for people with disc problems, lower back pain, this is a nice product to use. It's upright. We're not leaning on the product. We're upright, so I'm happy for patients to use that in a work environment. Remember, it's a medical product. We can also use another product if I just remove that off you, Stephanie. And remember, these outer covers can be washed, and it's the outer cover that absorbs the moisture from the air. And what that does, it penetrates the far infrared that's generated and stored in the ceramic pads, and that far infrared heat using the moisture is penetrated into the tissue, which helps with the pain management. Now, I just want to show you one last thing in this area. So we do have a lot of people in work who get things like RSI problems, and it's all people get lateral epicondylitis. So we get tennis elbow and we get golfer's elbow. So remember, the tennis elbow is on this side and the golfer's elbow is on this side, and that's is an issue to do with the tendons, overuse of those tendons. And so when you squeeze the patient's hand or grip, they get pain. And so for RSI, which is overuse in poor bad postures, if Steph's moved a bit closer on the chair, just sit a bit closer, if she wanted to rest that arm, she could use a smaller product like this, and that would give her some nice heat while she's resting that arm. Again, this small product here can also be used. It can be used around the neck. There's Velcro there that can be tied around. It can be used on the shoulder. But it's nice for the peripheral joints. If you've got some hand issues and shoulder injuries, you can get that moist heat. It's a small product, and you can use this product anywhere. And again, you'd use that for half an hour, depending on what the condition was.